It's hard to follow a talk of somebody who has survived a heart attack, so I'll do my best. But I just wanted to thank you all for attending and listening to and donating to a cause that is so helpful for so many people. So we're going to talk about women and heart disease and why it's such an important thing to talk about. These are my mom and dad. I had to give them a plug. But the reason I started speaking about health issues and whatnot, I used to be the one who didn't want to talk in front of people. My husband was a nurse in the emergency room and gave lots of talks about trauma and stuff, and I hated to speak in front of people. And then my mom started having some troubles. This is a picture of them for their 60th anniversary, and she lasted about 3 years after that. One of the first trips they took, they went to Greece, and my mom came back and was telling me that she had been climbing the steps to go visit the different attractions and that she got a jaw ache and her tooth was hurting, and so she was going to go see the dentist when she got back. And I told her, you know, Mom, that could be your heart. That sounds more like a heart. And at this time I was had been in practice in Nebraska for a year, and well, I was little Janie Borneman then to her, and she just poo-pooed me and said, oh, well, that's nice, honey, but I'm going to go see the dentist. So then she went to the dentist, and he said, your teeth are fine, but I'm agreeing with your daughter. I think you need to go see your doctor. I think there might be something up with your heart. Well, suddenly I became really smart then. Well, my daughter said that. So my mom went and got checked. And when she went to see him, she was a little put out that he said, well, Marianne, you have all the risk factors for heart disease. Why are you surprised? She says, well, what do you mean? And I got to thinking, if my mom, who raised all of us, had no idea that she was at risk for heart disease, maybe I needed to learn how to speak to people, because if she didn't know, good chances lots of people don't know. So my mom, who went to see her doctor, had no idea what her risk factors were. But this was my mom's history. She was 5'2", and as you could see in the picture from before, she was a little on the round side. About that time, she weighed maybe close to 200 pounds, and she always just joked that she wasn't overweight, she was just under tall. And the doctor, when he wrote his notes, said that, you know, she was an obese white female, and she got so offended. She said, he called me obese. I said, well, Mom, you are obese. Well, that's not very nice. I'm like, well, I know it's not very nice, but it's just a medical term. It just means that you weigh more than what you should for how tall you are. He's not calling you a name. He's not trying to be mean. He's just trying to describe what's going on. So she was not super happy with that. She was a smoker all my life. My mom smoked about 2 packs a day. And at that time, she had maybe been quit for a week. But, well, I'm not a smoker. So, Mom, you started smoking when you were 16 years old. The fact that you stopped a week ago doesn't negate that. So, okay. She's also diabetic. Well, I don't want to be diabetic. I don't like that. I don't really think I have diabetes. I think they're just wrong. So, well, your blood sugars were high, and this was before we checked A1Cs, and they probably would have been high. So, but you have diabetes. You're on medication for it, and so anyway, she wasn't thrilled with that. She also had high blood pressure. Well, she only had high blood pressure when she went to the doctor. That's just because I have that white coat thingy. I only get high blood pressure at the doctor's office. I'm like, well, okay, so let's check your blood pressure at home. Let's get a machine and check it at home. Well, the cuffs just make me nervous. So she had lots of excuses, but my mom had long-standing high blood pressure. Her cholesterol and her lipids were abnormal. And back when she first got diagnosed, we were learning about the different types, whether HDL, LDLs, and some of the small particle lipoproteins and things, but my mom had abnormal cholesterols. And again, she didn't really like that because, you know, well, one time I read that if my cholesterol's less than 250, then that's fine. And I tried to enlighten her that things had changed. And so, and then family history. My grandpa died at 63 from a massive heart attack. And I said, you know, Mom, Grandpa died at a young age. Well, he wasn't young. Like, well, 63 is young. That was, I said, Mom, how old are you? Well, I'm 68. I said, so do you think you're old? Well, no, I'm not. So, you know, she just had a misconception of what, you know, her dad to her was old because she was 30 when he died, but he was young. So all of the risk factors that go, my mom had them all, and she was just amazed at that. Calcium score, Dr. Grant was out there. Did any of you guys visit his booth? So I'm going to talk about it because I just did it. So right now, it's something you can order yourself, you can go get. But this is what kind of the recommendations are for healthy people and women over the age of 55 who have some risk factors. If you're having chest pain, don't go get a calcium score, go see your doctor. You do need to call and make an appointment. A few years ago, you could just walk up there to ADI and go in and get a calcium score, but they've gotten to be fairly popular, so now unless you want to sit and wait a long time, call the Mosaic operator and they can get you there and you can get in line to have it, and all I had to do was wait a day. Our cost is $50. It's not covered by insurance. It's not covered by Medicare, so it's a cash transaction. You don't have to have a doctor's order. You just need to call and make the appointment yourself. So I went at 4 o'clock in the afternoon, and I was out of there by 4:20. As you can see, I have my clothes on, so you don't have to get naked for it. You don't have to start an IV. You do have to put your arms over your head, and you go through this tube, and it took like 30 seconds. It was not a very long one. They talk you through, you hold your breath. But it was very, very easy. So we all need to take care of ourselves. We need to make sure we're getting regular checkups of our entire body, not just our reproductive organs, just like we do with our husbands, just like we do with our kids. Your lives matter, and women are the people who get their families to the doctor and through healthcare. So if you're not taking care of yourself, you're not going to be able to take care of your family. So make sure, just like they say on the airplane, put your mask on first, then take care of your kids. Make sure you're taking care of yourselves. So thank you all.